Hi, everyone. Thanks for listening to Here for the Health of It podcast. We have a great episode today. We have Whitney and Mo Huttenlocker with Sculpted by WH Aesthetics. They are professional injectors, and they get into all things beauty and medical spa. They're really getting into the regenerative space as well, and they walk us through what it was like at opening their business and all the things that they do. Hope you enjoy. Hi, everyone. Welcome to Here for the Health of It podcast. I'm Dr. Randy here with Dr. Tom, as always, and we have a great show for you today. We have Mo and Whitney Huttenlocker, who are the owners of Sculpted by WH Aesthetics. It's kind of a mouthful. And on Lady Street.
Correct.
Welcome to the show.
Thanks
for coming on here.
Thanks for having us.
So you guys are in kind of the private healthcare space, right? Tell us how you got into this. Give us your story.
I'll let Whit start with that one because I kind of just followed along.
4 years ago, I kind of fell in love with injecting and aesthetics. I got Botox for the first time when I was 30, and I was like, this is really cool. I love the way my skin looks, and just really love diving into like the artistic part of it. Growing up, I was very artistic, loved to draw. Also loved like medicine. I was like, this is a great way to combine both of those.
So I interrupt a lot.
That's okay.
How did you know that you needed Botox? Well, what was the moment when you decided I'm doing it?
I started noticing lines and wrinkles on my forehead.
Around your eyes too?
Not
Or no?
so much.
Oh.
I had just started treating my crow's feet, but it was mainly my forehead, and like my makeup would get set into my lines, and I was like, I got to do something about this. And I wanted to target it before it got really bad, like my mom's. So I was like, this is perfect. Had an injector down in Charleston. I was living there at the time, and she kind of was like my mentor. She's amazing. So
Right.
Sarah Rowe, love her. She's awesome. She's down in Charleston. So she kind of was my mentor, and I started shadowing with her, and I was like, I really want to do this. At the time, I was working in urgent care as a nurse practitioner. My clinic got shut down with COVID, and it was kind of the perfect opportunity to really like dive into aesthetics and see if it was what I really wanted to do. And it just grew from there and became like my passion. And I knew I didn't want to get back to urgent care after that.
So many people must have left the hospital during COVID.
Yeah. It was definitely a big transition out. So
Yeah, that I'll step in there. So she was working in urgent care, like you said, but they shared a room with a waiting room with a pulmonology. So you can imagine how COVID that doesn't work.
Oh,
Right.
So she worked remotely, and I was working 24s at the time. So she was working remotely from my pool, literally. And,
what's a 24?
24-hour shift.
Whoa.
Guy couldn't
and
put two and
anesthesia.
two together.
Well, it doesn't make sense to work 24 straight hours.
Well, it sounds
You have to be sleeping for some of it.
It sounds worse than it is, especially for at the smaller hospital I was at Park Ridge. I literally slept more there than I did. They have us a call room, so
That's nice.
I literally slept there more than I did at home.
Really?
Yeah.
So it's kind of a good deal to get a 24-hour
Yeah.
shift. It's better
It's pretty
because with a
solid.
12-hour shift, you're probably expected to be awake most of the time.
Absolutely.
Or the 24-hour shift, you're just
Right.
sleeping.
If there's nothing going on in the OR, yeah, you're chilling, watching Netflix, and just
Yeah.
sleeping.
yeah, there was a lot of Netflix
But so
when he worked his
But I'm so
24s.
groggy when I wake up and
It's
after
poor
sleeping
sleep.
for a while. Is it? So
it's
you're
bad sleep
we're sleeping a little.
You got a phone halfway stuck up
Right,
here. You know what?
right,
Because
right.
you're worried that it's going to go off, or
Yeah.
and then you got to be upstairs for a stat C-section, or yeah. So so our I hate to admit it, but COVID was probably the best thing that ever happened to us, because as COVID was ending, Whit's boss had started, hey, we're probably going to reopen this urgent care, blah blah blah. But we'd already had discussions with them that she wasn't going home. She lived in Charleston at the time. So
Okay.
so when they called her back, Whit actually didn't even have a job lined up. She'd already been studying aesthetics, and so yeah, we rolled the dice and said, go ahead, and,
Just
don't
did
need a
it.
job, let's go.
Yep.
'Cause
What was your guys' love story though? How did you guys meet? What's the connection
That's
there?
a long one. We met at the Heritage golf tournament. We're both
No
big-
kidding.
Yeah, it's a fun time. If you've never been, you should totally go to the Heritage.
Oh, yeah.
Not as like stuffy as the Masters. Masters
Right.
great, but Heritage is more of like a party and fun time.
Yeah.
So that's the first time we ever met. We had mutual friends. I was living in Charleston at the time. So I was like, this guy's kind of cute, but I wasn't ready to be in a relationship. Neither was he. So then like over the next year and a half, we would run into each other randomly, usually when I was in town for a football game. And again, mutual friends, we would end up being at the same place. And then one day he finally reached out and asked to take me on a date. So
Via
it's like, well, if
Instagram.
you're going to come to
Was
Charleston,
it Instagram? Was it Instagram? Huh? DM?
No.
Oh,
I think you actually had. I think you
even-
got my number.
I
from
might not even had an
Fred.
Instagram back then, man. I'm a late bloomer.
Yeah, he's not big
I'm
on
old.
social media. I like have to do most of his social media for him for work. But so yeah, he called me up. He came down to Charleston. We spent the weekend together, and then it was from there.
I had the backup plan. I had a backpack just in case.
He did bring it back.
When I first got there, I was like, I might have to be somewhere tomorrow back in Columbia. Just,
Smart.
I didn't know how
Yeah.
it was gonna go.
And
didn't
I
commit
was
to the
not. I
weekend
was
yet.
like, yeah, I know what you're doing, but okay. So yeah, he ended up staying the whole weekend. His plans that he had for the next day just happened to fall through, so he stayed for the whole time. And yeah, then I slowly just kind of made the transition back to Columbia. He wouldn't have made it in Charleston. I told him that. We kind of went back and forth between where we were going to end up, and yeah.
Columbia's great.
I love Columbia. It's
We were talking to someone who moved here, and he said he had the whole country to choose from. And he did all the analysis, spreadsheets, everything, airports, university, cost of living, everything, traffic, and Columbia is what he came up with. He could live anywhere in the entire country and chose Columbia.
I moved here right out of undergrad, thinking I was going to go to grad school at USC, and then ended up in Nashville. And when I was graduated there, I was like, I actually like Columbia. They pay well, cost of living's low, so I came back and never left.
Love it.
Now, when you guys meet people just in your industry, are you thinking, like, you look at their face and you go, they need this? Like, are you assessing? Do you do that? Like out in public?
Yeah, it's kind of hard not to at
Yeah.
this point, but I always like to tell my clients too, like, I'm never going to tell you need something. Like, if it's something that will benefit and make you feel
Yes.
good and more confident, then I have a lot of different options and tools for you. But
Yes.
never like to tell anybody they need. But I'm like, yeah, I think they could really benefit for like some Botox or like a laser treatment.
Consultations
and
are usually what bothers you about
Right.
yourself.
what's
Not a list of
I
things.
know
that you're
what
like,
is bothering me. But
now, you guys always do like a pre-pick, like a picture of somebody to show them,
oh yeah,
before and after,
So-
always.
and then do you draw on the picture? Like, let's
do.
take in a little bit here. Let's plump this.
So I
Your
do
little puffy
pictures.
here.
Yeah,
All
and
the
I'm
buzzwords.
very my staff. I know I like get on their nerves so bad because I like hone in on before and afters and like good consistent pictures. But it's important because
Right.
people are investing like a lot of money. I have to be able to show them when they come back a year later, like what has all this done for your face and your skin. So yeah, I always have like good pictures. Draw on that, show them what I can do.
Today's episode is brought to you by our sponsor, Columbia Family Chiropractic, with 3 easy-to-get-to locations, one in Forest Acres, which is by Trader Joe's, one in O'Neill Court by the DMV, and one in the Northeast by Sand Hills. You'll be sure to have somewhere near you. They offer a ton of services from corrective care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling for injuries, pediatric care, and a Class 4 laser. They accept all your major insurances. And if you mention this ad, you'll get a discount on your first appointment. Check out their website at cfc4health.com or Google Columbia Family Chiropractic. That's cfc4health.com.
Now,
So
what
for
is in the
sure.
toolbox? Like, what is what are all the services that would be available? And have you ever had a person where it's like, just go through them all?
Yes. So I always say like Botox is kind of like the gateway drug when it comes to
Yeah.
aesthetics and good skincare.
you
But
in
we
the
have a
game.
lot of other things. Fillers. I do a lot of PDO threads, which I don't know if you're familiar
clue
with
what that
threads.
is.
It's basically like a little non-surgical facelift.
Like, cinch it back.
I've
Literally-
been getting ads for that lately.
Yeah.
Like, since
I think AI took my face and started telling me what I need.
Yeah, but it's great for clients that don't want to get a facelift and they don't want surgery. It's a great alternative for them.
Really?
What else we do? We do lasers, CO2 laser. We do like BBL Moxie. So if people are looking to help with fine lines and wrinkles or like pigmentation, we have lasers for that. Facial services, microneedling, IV therapy. We've really kind of built up like our health and wellness side of the business
Yeah.
now, which Mo's kind of taken over that when it comes to semaglutide, which I'm sure y'all
Yeah,
familiar
yeah.
with that.
The weight loss injection.
Yeah, oh, yeah.
injection.
Body
IV
contouring.
therapy, body contouring. So it's kind of full circle at this point.
Can you inject, or like, do you guys inject into butts?
Yes. It's not as common in Columbia. I feel like places
big
that are
cities.
closer to the
Yeah.
beach, Miami, Charleston. But yes, we do have.
What size can you get something to? Like if you're working with something real
Oh.
flat.
I mean, you can get there. It might take like
Really?
120 syringes and a lot of money,
kidding.
but you can definitely do it.
And then how long does it last for if somebody did that? Is
Like the BBL or the
Yeah.
non-surgical butt lift. It could last like several years. Usually people might need a couple of sessions. It's really like stimulating collagen and adding volume. So, but yeah, it's a pricier treatment, but people, if they want it, they'll pay for it.
So for Randy's calf muscles, he really just doesn't have much, and his dad's are incredible. If he wanted those bigger, you could just kind of contour them in.
I wouldn't inject calves. That would be physique. So
Okay.
for building muscle.
Gotcha.
So different.
Oh.
Yeah, but definitely have something for that too.
I got the same problem, by the way. My dads were like,
It's something
Cannons
about
on
I don't know how they do it. It's that generation. They don't stop climbing ladders.
calf raises.
So so all the things that you just said, I don't know anything about, or I know some about, but I don't know the details about it. So let's say microneedling. I don't quite know how successful it would be, the before and after, how many treatments it would take, who would do it, why you would start at that point.
So micro needling is collagen induction therapy.
Okay.
You could do it at any age. It's great if somebody is wanting maybe like even for acne scarring or fine lines and wrinkles or just looking for something that's like preventative. So it uses a lot of little tiny needles basically to cause controlled trauma to the skin, and then your body has to repair itself and build new collagen. So that's how it works.
So that would be on the more holistic side because there's nothing.
It's not
going into
injectable.
you.
Exactly.
Yes.
So if somebody's looking for something,
you got some glides.
yeah, and we have glides that go along with it. So stimulate more collagen, but that's a whole nother, yeah.
I don't know what a glide is.
Oh, so we have a new one. Should I bring that up?
So like lube?
Basically, yeah.
Oh, I pictured it like a scalpel kind of.
No, glide, like it's almost like a liquid substance.
Yeah.
And it just helps you glide across it, and it's also stamping that into the skin.
Right, for more health benefits. So the new one out right now is like the salmon sperm facial. I don't know if you've heard of this, but
Sperm?
it's yep.
The,
Thought you might
the
like that.
semen. Did you say the semen sperm?
Randy gets that weekly,
The
don't you?
salmon. So it's literally from salmon DNA, but it's from
Yeah.
Kim Kardashian.
No
just like
way.
blew it up, like when she takes something and runs with it.
All right. So how does that treatment start? Where does somebody go?
Right.
This is a substance that needs to be
Stamped into people's face.
They've been studying it for years, and it's finally came to market recently. But literally, it's PDRN. So it's
Yeah,
I'm shocked. I'm shocked about because
Yeah.
I remember people always saying that swallowing sperm would make your boobs bigger.
I don't know if that's true.
I think guys just
but-
made that up.
that's what I felt like, and I kind of feel like this semen thing might be along
Right,
the same
right,
world.
right.
Yeah, it's like somebody getting caught in an act of something and be like, "Oh yeah, no, this is a
Oh, it's
cutting
great
edge
for your skin.
treatment."
People pay hundreds of
Don't
dollars.
ask
for
don't ask
this.
how they found out.
All right, and then
So microneedle it into the skin. It's amazing. Get good glowy skin, get collagen stimulation.
yeah.
It helps the body repair itself. So
who's donating this?
I was
Is
gonna
this-
ask
do you get
if
to
you
choose?
can request.
Yeah, do you get to
specific
choose?
semen.
Like, I wanna
I brought my own today.
Yeah, what? I'd love a 6'5" guy, muscular.
Right.
What do you? So you guys just get? Does it look like semen? Like when you
No,
guys
it's-
get it, what does it look
it's
like?
literally just like a clear serum.
Are we children too? Is this like?
No, this is a great
It's
Okay,
It's a real. I mean, it's like really big right now. But
Yeah.
you're looking like, what's the new thing in aesthetics?
Yeah,
Like
yeah.
salmon DNA and using that for regenerative purposes.
Right.
We love regenerative medicine. So anything that's like building up new collagen and elastin, I like that. Obviously, there's a place for filler and Botox, but if I can do things that actually help people regenerate like their own collagen,
Right.
that's amazing. So
Yeah.
Is it from the all from the same? Like each one's from the same guy?
no, it's
Or
from
it's just a
salmon.
mix?
It's from
Oh,
the fish.
salmon.
Salmon.
Yeah.
Oh, not semen.
Her accent was
Salmon.
confusing
Salmon.
me too.
Wait,
Salmon.
Have you been saying
Salmon.
semen? Have you been saying salmon
Wait, is it-
the whole
Yes.
time?
She calls it salmon. It's
We
salmon.
thought you were saying
Sorry.
Salmon.
I thought you were saying
Oh
semen.
my God!
It is.
Wait a
It's
minute.
It's salmon semen. Salmon.
Oh, it's salmon semen.
Right.
What? What's happening?
We're so ignorant of everything in this. I was lost too.
Yeah,
I was thinking.
thought sometimes you were saying salmon, sometimes you're saying semen, but you
No,
were
it's
saying
just
like
my accent. I'm
the-
from Jefferson,
All right,
South Carolina.
so the fish, the salmon,
yes. Yes.
has semen.
Yeah.
Yes.
DNA. You can say salmon.
And
I
you
feel
would
like I need to
s-
change
and
how I
you
say
would
salmon now because it sounds
And you
like
take the semen and you microneedle their face so they have mini traumas, and then you wipe it into
it is
there.
sent to us already pre-packaged, so we don't
Yeah.
have to deal with it.
You're not
Okay.
cutting fish
No,
in the
we're
back.
not cutting fish
right.
open.
Got some new one from Publix.
I used to get that. I worked on a pig farm when I was 16, and they used to send us packets of semen for the pigs, and you'd have to put it in there to get them all pregnant.
Wait, you did that?
I mean, I didn't.
You
I
impregnated-
didn't actually stick it in, but I held the semen bags and handed it to the farmer.
You were the jizz guy, the jizz bag guy.
I just walk in holding.
With like a
bags.
turkey baster or what?
God.
Yeah, but it was a long. It was like a
fancy
pretty
machine.
long tube.
Nice.
Wow, I didn't know. I didn't know we were going this whole direction.
I didn't. I didn't know
I'm
that
here to learn
salmon
about-
semen was even a thing. But
No.
it's.
Oh, yeah.
It's
yeah,
nice.
PDRN is what actually they get for it. So it's basically
PDRN.
polydioxynucleotides, if I
Okay.
said that big long word correctly. But yeah, DNA.
I wonder why the fish, like why salmon?
Right.
Why not like a
Why not a
chimpanzee
trout?
or whatever? Like that's what's weird about the whole thing.
Right.
All right.
Fresh to the
So-
it's
yeah,
brand new
this-
to the market. It's been out for like 2 months.
Yeah.
But once a Kardashian puts it on their face,
Right.
Then it's everybody.
Yeah.
Yeah.
Do guys do it too?
Yeah.
Okay. And
If you want brighter, glowier skin, healthier skin, it's amazing.
and just the face, or would you do neck, back?
You could do your whole body.
Yeah. Okay.
Nobody's asked for that. Yeah, mainly
Lower
people
back.
focus like from here up. But
But you could microneedle your neck,
yes,
right? Okay.
definitely.
All right.
What about like the red bumpy skin? What do you do for that?
Red bumpy skin.
Yeah, like the back of my
acne,
arms
or-
are always red and kind of bumpy, and I think it might be a gluten sensitivity,
could be.
but I still eat gluten. And
Gluten's
it's
hard to
only
get
that
back.
one. It's only that one area, so I didn't know if there's a way to like shave it down or.
Different skincare products can help with like because I have it too. It's called KP, but different products like exfoliating products can
Yeah.
help with that. Facials. To
So
kinda
there's
clean up the
hope.
skin. There is hope.
Facial
Yes.
on the arm.
Yeah.
Armals.
You
Arms.
You can do a
Armsies.
facial on your arm. Yeah. Do
Okay.
a diamond glow.
Diamond glow. Mm-hmm. What's the longest treatment? Like how long could we be at your place for?
Some of our facials go 90 minutes.
Really?
Yeah, and depending on if I'm doing lift and threads and filler, it could go up to 2 hours, depending on how many areas of the face I'm treating.
And what order do you go in? Like when you have a facial, do you start with the lift and tuck deal, and then lotion and?
If I'm,
Most clients
I
that come
need
in
to do
for
a facial.
a specific service. So
Right.
like, okay, but a good question. So let's say I want to come in for my Botox round
Yep.
and I want a facial.
Yep.
You would do the facial first because you don't want to manipulate the area after.
Once you- okay.
So and then you do the Botox.
Got it.
And then so the esthetician, would do the facial and then they'd be on Witt's books to follow.
Got it. That makes sense.
Let's talk guys a little bit too, because I never know what a guy would want.
What should we-
or
what kind of
should
regimen?
have. Even when I look at my beard, I'm getting a lot of white in my beard.
Oh yeah.
Which you're
too.
getting a little
Oh,
too.
yeah.
Yeah, it's not quite as
By
much yet.
tomorrow you'll
but
see.
it's,
No, when it grows out a little bit, it's a lot more
yeah,
prevalent.
and I somewhat think that it's in. I think it's a good look.
I do too.
Yeah,
Salt
but
and pepper.
yeah, but I don't know like if that's a thing that people are trying to get the look for, or if we're just lucky and naturally have it.
I like to think we're just lucky and natural.
You think so? So no one comes in and says like, I want a little more salt in
Nah.
my beard.
Nah, they
want the
We don't
opposite.
do anything
You
like
want
that.
they want less salt in their beard, all pepper.
I would think more so than not, but we definitely get it to guys. Guys are usually either semaglutide with me.
Okay.
Want to lose a little weight.
Yep.
A lot of tox. They do like their Botox.
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 We've actually got some guys that come in for laser hair removal too.
A lot
Really?
of guys
Where
for
they
laser
where
hair.
they getting it?
You'd be surprised.
Butthole.
Everywhere, whole body.
We actually do have one or two that are Brazilian.
No kidding.
That's a process to where you sign up for like a package of 6. You can't just come in and we're going
Right.
to zap you one time. You're never going to grow
Yeah,
hair.
it's
Is
a
that pain-
process.
Does it
It's a
hurt?
process.
Is that painful?
It's not bad.
Not bad.
Our device is pretty painless, but there's definitely some uncomfortableness there for sure.
And they're getting the beanbag. Like, they're zapping that.
Yep.
Really?
What about platelet-rich plasma? I mean, I'm kind of all over the place.
No,
I'm
that's a
thinking
good
about it,
question.
We got a
would
lot.
you
We're
play-
excited over here.
Yeah, I'm pumped.
Just whatever comes to mind, it's coming out.
So we do have both platelet-rich plasma or platelet-rich fibrin, And we steer more towards the fibrin because we feel like you get more out of it. And the industry's kind of moved that way over the last year and a half, 2 years.
It's superior. It's more concentrated. You get an extended release of growth factors. So we do a lot of PRF. I really don't do PRP unless I'm doing it for like hair restoration, but then I still like my PRF better.
I'll draw your blood, take it to the lab, spin it down in a centrifuge, and then there's a little like clearish yellow on top, and that's the good stuff. So then we'll draw just that out. All the red blood cells and everything else is below it. Yeah. And then inject that big under the eyes. It's great for crepey, dark circles. But yeah,
Liquid gold.
That's a big product. We do that a lot.
And you can spray it too, I think, right? Can it be put into a spray bottle and you spray it on your face or your hair?
You know how
I don't
we
know
were
how
talking
well that
with
would
the
work, or
microneedling?
actually.
It could be a glide for microneedling. That's a service that we offer too.
Okay.
But it needs penetration.
It's got to be down into the skin.
So
yeah.
Right. Molecularly, it's too big to go just topical and then think you're
Right.
going to get something in it.
It would have to be after
you either stamp it
microneedling,
in
maybe.
or you
Yeah.
or you put it in with the canine.
Got it.
Yeah, it's the biggest service
Great
for
product.
like hair restoration. So people that are, receding.
They do my hair.
I do most.
Really?
They go
Great.
right on the hairline and where your creases are.
Yeah.
That way you,
How deep's that needle? Like, what are we talking?
it's spicy.
Really?
Oh yeah. I'm sitting there like this all the time.
Do they hit bone? Like, do you go down to the bone?
You go pretty deep, like not only
Just
down
above
the
bone.
but-
Wow.
Yeah. But yeah, that's a big treatment too. Women
Yeah.
do that too. They're thinning.
Really? I've heard that it's good, but the thing is, you just never know. Like half the time,
My brother tried it in St. Louis, but no offense, bro, but he, I think he was a little too far gone. You know what I mean with the receding.
yeah.
Yeah.
Whereas it's more for guys like us that have that. You know what I mean? Yeah, I'm receding, but I still got thick hair there.
Something to work
Yeah.
with.
Right.
It's very dependent too on how healthy you are. So we kind of have like a protocol with our clients coming in to get that. Being hydrated, working out, like what you're eating, all that is going to play a part into how effective it is and how good of a sample we get. So that's a big part of it.
Do you guys have a process where, like, if we came in, we just got naked-ish, and you guys would just do a whole workup on the body and say, let's cinch you in here, or is that not, you're mostly upper?
Mostly faces, but we do a lot of body. So like even when I came up with the name Sculpted, I started as WH
Right.
Aesthetics when I was by myself and like had to come up with like my LLC. And then when we rebranded and opened our space and had to figure out like, okay, well, what's our name going to be?
Yeah.
Like I chose Sculpted because I knew at some point I wanted to get into more body treatments too and like encompass the whole body. So, so yeah, we do a lot with body contour and we have a new device. We've had Physique for over a year now, but we just upgraded to Physique 360. So with that device, you can target and like do body contouring. So arms,
Love handles.
abdomen, love handles,
Cellulite.
butt. Yeah.
Yeah. Okay.
But-
So
but
that
yes,
could be a thing.
yes.
And is that red light or is it the cool sculpting or is that different?
Laser diode.
Okay.
Yep. So it uses that and then muscle stimulation. So you can kind of like customize it depending on what the person's complaints are, what kind of result they're wanting to achieve.
But yeah, Tom, they come in, take their shirt off and say, "This is what bothers me right here," and then we're like, that's more skin tightening. So you might need a radio frequency device versus, you know what I mean? I want to debulk and still get the muscle.
Right.
Yeah. What about it? Like, I find whenever I do a lot of chest, my nipples are too hard and they're just always through my
What
shirt.
do you do for nipples?
Our device, you cannot do pecs, which I hate
Really?
because that's like the biggest thing I hate about myself. You know what I mean? If there was going to be a thing,
Yeah.
Yep.
because it's got electrical stimulus and it's too close to the heart.
No kidding.
Yeah.
Yeah.
So arms, like
So
Whit
no
said,
nipple softening.
No,
No, we don't have
sorry.
anything for that.
Softer
Sorry.
shirts, bro.
Back alleys or
Quarter zips.
Okay, yeah. What is all the equipment that you guys have? Do you guys buy all that? Do you lease all that? What is some of it?
Good
so
question.
much.
So we are, I mean, realistically speaking, we're probably around 600,000-700,000 in devices.
equipment.
But so what we did is we first started out and we're like, oh, we're paying cash for everything.
Right.
We bought 2 very expensive pieces of equipment and paid cash for them. And then the more we got in this industry and the more I started building the credit for the company itself, it was pretty obvious that there's absolutely zero reason to pay cash for these devices.
Yeah.
So the last 2 or 3 or 4 we've leased, but unfortunately fortunately, however you want to look at it, the first 2 probably cost as much as the last 4. So,
Right.
but again, you live and you learn.
Yeah.
I'm a science major. I was never a business major,
Well, what?
Neither one of us.
but
were,
I am now.
Right.
Can you name some of them and tell us what they are?
Absolutely.
Yeah, so we have Cyton, BBL, Moxie, which that was my
These
first
are the expensive
baby.
ones.
Yeah. And then we also use their Bayer HR for laser hair removal. So those were our first 2 devices.
Explain them what the BBL Moxie does.
BBL Moxie, so that helps with pigment. So if you have like reds, broken
yeah.
capillaries, if you have sun damage on your
like
face,
I've got right here.
Yeah.
melasma. Moxie is better for melasma specifically. BBL better for like sunspots, age spots. And they also stimulate collagen too, which is great. So Moxie's kind of like your anti-aging laser. Not a lot of downtime with these, which people love, but the results are crazy good. So obviously we talked about laser hair with the Bayer HR. Our other devices, we have Virtue RF, which is our microneedling radio frequency device for like skin tightening. We have Physique 360, that's our body contouring. We have a Tetra Cool Pill, so that is our CO2 laser. That's more for clients that have deeper fine lines and wrinkles and need like an ablative laser. Lots of cool things we can do with that laser too, even for like eyelids, people that don't want to get a blepharoplasty or surgery for their eyelids. Like you can really tighten that skin up with a CO2 laser. Am I missing anything?
No.
We have a plasma pen, Subnovi. I don't use it that much in practice. I have other
Yeah.
things I like better, but it's available.
But that BBL Moxie is my favorite, especially at the end of the summer when you're getting back, you're not in the sun because you got to be 2 weeks before and 2 weeks after. But yeah, it really clean up all these sun damage that I got. I'm a sun, WHORE. So
Yeah, well, BBL mocks him and he'll go play golf like in
Right.
100-degree weather and not wear his sunscreen and hat, which
Yeah.
I get so mad. And then
and then that Physique 360 is awesome. So we pair that with our semaglutide clients. So you guys know what semaglutide is, right?
Oh, yeah.
Okay.
So, let's tell everyone. Ozempic and Wegovy, I think are the
Correct.
2 big ones, right?
Correct. But the FDA's approval, this is great for everybody to know, that we can't get Ozempic or Wegovy, right? But what the FDA did say was if you get it compounded from a 504B compounding pharmacy, then you can give it to your clients.
Gotcha.
So we always got to put that disclaimer out there. You're not getting Ozempic. You're getting, but if you look at the commercials,
Yeah.
when you look under Ozempic, what it is semaglutide.
Okay.
So it's
Right.
the same
Name
thing.
brand
it's like
versus
buying
generic.
Walgreens
Or
ibuprofen
compound.
versus
Exactly.
Advil.
And is it because everybody was running out of it
Absolutely.
for diabetes, so they said you can't sell it for weight loss anymore?
Right. So it started out diabetes, and then once FDA cleared it for weight loss, all the gynecologists, med spas, your PCPs, everybody was writing scripts like crazy. So
Yeah.
that's when the FDA had to step back in and be like, okay, we got to save this for diabetic patients that need it because the supply and demand was way off.
And so I'm hearing kind of 2 sides of the equations when it comes to semaglutide. I'm hearing on one side, there's medical industries that are really worried because so many people are using it. They're canceling their knee surgeries and their hip surgeries, and they're having less heart attacks and all the things that come with obesity.
Right.
Those industries are feeling it.
I've got a client literally, now that you point that out, she was coming in, her physician told her, yeah, you're a candidate for knee surgery, but you have to lose weight first.
Right.
As she started losing the weight, she's like, my knees don't hurt anymore. So it's exactly what
Doesn't
you're
need
saying.
it, yes.
Not saying, trust me, I grew up in the anesthesia industry, so not to say that surgery's not, a necessity, but
But
a lot of people,
it
if you
affects
lose
the
your weight,
suppliers,
it's gonna
the
be-
sales reps,
right.
the ORs, all of it.
But what's cool about semaglutide, and what I see the most of is, man, the confidence in these people. You know what I mean? They come in, and 2 months later, you realize, damn, you lost 45 pounds, dude. Can you imagine walking around with a 45-pound backpack on your
Right.
back?
Even 5 pounds.
Right.
Right.
And their faces, and you can just see it in their face. Just so I've got one client that she almost had me in tears. She was like, Mo, I've just, I can work out now.
Right.
I've had to buy a whole new wardrobe. Like it's pretty cool to see that too. So it's not just, for attractiveness or anything like that.
Right.
It's really changing people's lives. Pretty cool.
Yeah, and we were very on the fence before we brought it on because it kind of had that reputation at the
Right.
time. And after we really did our research and we saw just all the other health benefits coming out with it, and I was like, I think this could be great.
We're
So,
looking at A1C, cholesterol, blood pressure.
and the way we do it, our clients come in and see us weekly. We're not writing a script and saying, hey, here you go, bye, good luck.
Right.
They come in weekly, we dose them, we monitor them.
Absolutely.
So
Which
it's-
is a lot different than most do.
Yeah.
Most
Well, I feel
people
like a
just
lot,
write
it's
you
kind
script.
of,
But yeah,
to
it's
each
just the
their
way we
own with
like to
how you do it, but that's
Yeah.
how we chose to do it. And I think our clients really appreciate that. And that was kind of the only way we would bring it on if we were managing it and dosing and
Right.
monitoring. So
Well, and then there's
Sorry,
the other. Well, so then there's the other side of it, which is medications are always going to have some sort of side effect. They're going to, and it's so new. I don't know if we know what it looks like 10 years, 20 years.
Right.
Obviously,
years.
no long-term studies on it yet.
And my understanding is that I was talking to a nurse anesthetist who said you can't have surgery right after, or if you're on it, you have to be off it for, they have certain things now, 10 days or 12 days.
We do.
But because there's the risk of aspiration from food content still in your stomach.
Right.
So it's my understanding then is it almost stops your stomach from digesting your food, so you're not hungry.
You're close. So from start to finish, right? Your GI tract's always moving.
mouth to
butt for those of you listening.
Yeah. Sorry. It's called peristalsis. So your GI tract's always moving, always, right? So what it does is it slows that process, right? So, true to your point, what that translates to is your gastric emptying is slowed down, right? So you do feel fuller longer, but at that, you're risking
10 days is a long time. Like
this
that, when I
medication-
heard that, it kind of worried me that food shouldn't stay in your body for 10 days.
Right. Well, it's not just
Ideally.
food. You know, when that gastric emptying is delayed, you got acid secretions and all that stuff that's still in there too. So even if you haven't had breakfast today, you still have got something in your stomach. You know what I mean?
Yep.
Gastric juices and all that. But yeah, so common side effects or, or not common, but something you can get is acid reflux or constipation. That's why we always make sure that they're on real high hydration, lots of water.
And in an ideal world, there's maybe someone who needs it to kickstart.
Right.
But
and I get
they
that a lot too.
I think some people look at it like they're going to take it for the rest of their life.
No, most
Well,
people
there's
are.
skinny people taking it too that shouldn't be.
We do have baselines for that. We have a protocol in line that, it's basically BMI. If your BMI is lower than 26, 27, or, you know what I mean?
Not work,
jump on the physique or, if you want to do a little debulking around the waist, but we can't put you on this medication. It's just morally and ethically, it's just not right.
Yep.
And the body weights change. I've also heard, and you can speak to this too, the muscle mass being lost is very high. It's not just the fat loss.
Right. So what we do to combat that is, obviously these portion sizes are going to go down, right? So we encourage, and we have literature that says high protein. Yeah. Because like exactly what you said, you don't want to lose muscle mass. You want to lose adipose tissue.
Yes.
Does the equipment take up much space in the place?
We have 8 treatment rooms, and we kind of just store one in each room.
Yeah.
Like the physique's got its own room, but they also do facials in there. So, it's just in the corner unless we need it, we pull it out. But
Are they
we
pretty
have to
mobile?
shift things around. Yeah,
Yeah.
we have to move them around, but for the most part, they kind of have their own room, designated area, and we try to keep
to
it
keep
that
them
way.
in their room. They're expensive devices.
Yeah.
I don't want them bumping into walls and moving them to different rooms.
Right. Yeah, you got to be careful who's using it and who's around it too. We found that with some of our equipment.
Yeah, exactly.
What about tattoos? Are there any treatments you can't do with tattoos or certain
Yeah, that physique, same.
can't do it with a tattoo?
Right. So
Right,
you can't go
BBL,
straight
you don't
over.
want a tattoo over a BBL. Or a BBL over a tattoo, sorry.
Right.
But yeah, certain things, you gotta be careful with that. So like tattoos, you have to cover if you're doing physique. BBL, don't want to do that over a tattoo.
Yikes.
And we get that question a lot too about tattoo removal. Don't do that yet, maybe in the future. But
There's a
certain laser for that.
Right. We didn't dive into that one because we were, apparently it's an art and you got to get good at it.
Right.
Just like putting it on, you got to get good at taking them off.
Right.
Really?
We just haven't dove into that one yet.
Can they be removed to the point where you can't tell they were there?
Absolutely.
Really?
It takes several
sessions, right.
Yes.
But yes, you got a good device. Like certain lasers are better than others. They're more expensive, but again, you can remove it. It just takes like several sessions to be able to do that.
It's because the old thing with the tattoo was always if you get a tattoo, you're going to regret that later, which a lot of people do. They're like, that was
I've
silly
got a couple
what
I regret.
what I did. But you don't really.
16 in Mexico, nobody really told me that.
Really?
What
you were
What'd you
14.
get? Look, give it. What is it?
dude, this gets even worse. It's a tramp stamp.
Yeah. Is it?
Yeah.
So
That's
my
great.
twin brother and I, we were literally like, I think we were 14 or 15 in Mexico. And my dad, somehow talked my dad and let us get one in Mexico. So we both got
wild.
our football, high school, and baseball numbers on our lower back. My brother's actually since created something that goes
Like
up
make
his
it
back
bigger,
to
yeah.
right. So he technically doesn't have a tramp stamp
That's
anymore.
great. Yeah.
I'm the only one.
Sorry, are you just
So
going to
wait,
let it
when
ride?
But now, mind you,
when Whitney first meets you,
right. Is that
Yeah.
a target on your back? Like, what are we going with here? Yeah. No,
Oh
that
my
one I
God.
regret a little bit.
I've gotten over at this point. I'm just like, whatever.
Yeah.
It doesn't
You got to
bother
explain
me.
that early in the relationship, right?
Right.
You got to just like get,
Right. It wasn't a phase. This is just it just wasn't a smart move.
Were you surprised when you saw it? Or did he
I
tell
mean,
you? Did he,
I was just like,
did he
okay.
preemptively tell you, or did he
No,
just
I
let you
just
see
saw
it
it
on
right
his
at the
own?
pool one day, and I'm like, what's that? That's interesting. Like,
I actually most of the time forget about it because I mean I'm 42 years old.
Right.
This was what 30 years ago almost.
when other people see it, it's funny. Like,
That is
Oh,
great.
my,
I think
my
our
buddies
staff
give me
was over.
all crap all the
Yeah.
time.
That's
about it.
awesome.
Yeah.
The staff were at the pool one day, and I think one of Emily
sure.
was giving you a hard
Yeah,
time
yeah.
about it.
Yeah.
She likes to pick on you about
That,
it.
and the thing is, if you get it removed, you might realize that you actually really liked it.
Yeah, I mean,
That's how my wife was
Yeah.
with my tooth. When I got my tooth knocked out, it looked, I mean, Tom made fun of me all the time.
God.
I had my flipper was falling out. It was a thing. But like, my wife kind of liked it because it was just like a symbol of playing hockey.
Right.
yeah.
And then when I got my teeth fixed, she was like, I miss you having just
You're way
missing
more manly.
missing
Way
a
more
front
manly
tooth.
without a tooth. That's awesome.
All right, what's an ideal client regimen? Like if you guys were to make up a artificial person and said, this is who I would want to use it, and how often to use your guys' business.
I'll let Whit allude to that one because she's actually we've moved towards year long.
Yes.
Not commitment
Yeah.
by
Like
any means,
plans
but like
are-
this is what you're asking me my professional opinion. This is what I think you need this month. This is what
Yep.
I think you need. 2
I love
months
a
from
good
now.
regimen.
Yeah, we try to bring everybody in and do like an initial consultation. I spend a lot of time with them, but I set them up for the year. So it's not just a one and done, And I think that sometimes people will come in, they're like, just fix my face.
Yeah.
Like, well, it's not that easy. Burns is going to take
Right.
multiple treatments, multiple modalities. It's not a one and done. I kind of describe it too like going to the dentist. You go and get your teeth clean. Like if you're not
Right. brushing
and flossing at home, it's pointless. So skincare. Everybody needs like 5 things if you're over 30. You need a good cleanser. You need a moisturizer. You need a vitamin C. You need a retinol. And you need sunscreen. So that's like the 5 basics. Like
And water.
and water, lots of hydration. Because if I'm doing your Botox and fillers, but you're not doing that, like
Right.
it's not gonna last long. Like your skin's still not gonna look like it's best. So that's like starters for everybody. And then your Botox every 3 to 4 months. Those are like the 2 things that I kind of start everybody on. And then good, skincare. So doing your facials every month or so.
Once a month facials.
Once a
good
month
Reggie.
facial is a good starter point, especially for my younger clients. I have more and more people coming in younger that want fillers, and I'm trying to get them away from that and really focus on doing things just to take care of their skin. So my young clients, good skincare and facials. Microneedling's also great just for collagen stimulation. And then my filler clients are coming in probably once a year for their maintenance treatment. But yeah, we're kind of going a lot more towards regenerative medicine. So
Yeah.
laser treatments, I'm trying to do as least amount of filler as I can because I don't want my clients looking fake or
Right.
what we call the pillow face. And I think fillers have a bad reputation in general because people think of fillers like with the housewives. We were talking about Bravo
Right.
earlier, like that kind of look. And that's not what it should look like. I always tell people that good injectables are undetectable. The people that are coming, they're like,
That's a
oh, well,
t-shirt. That's
yeah, good
Oh,
injectables,
that would be a good
undetectable.
slogan.
Yeah.
But yeah, like people say, oh, well, you don't need this or you don't need that. Yeah, because I do it. I just have it done well. So
Right.
people don't know I've had things done, and that's kind of I feel like the reputation that I've tried to build for myself is having natural results and long-standing results too.
Yeah.
So my clients appreciate that. I'll tell them no in a heartbeat.
Well, I think the industry in general has gotten better about that too.
Yeah.
Because I remember a couple years ago, like you would hear with someone or see someone with filler in their lips, and you'd be like,
Right.
"Whoa,
Right.
what's
That's
going
rough.
on?"
Right. We joke about that if you leave our place, your lips aren't going to walk out before you do, like a lot of places do.
Right. Yeah.
That's good.
But yeah, we're dissolving a lot more and more these days too.
What do you
Look
do
like-
with a person that's overdone it? Like, do you get people that have come from other places and how do you go backwards?
Dissolve it.
Oh, there's there's an
Yeah.
opposite product. Oh, I
There
didn't know
is. So we're dissolving a lot more filler these days. I go through Hylenex like candy at this space. I feel like you're ordering that all the
Hylenex
time.
is the
Yeah.
reversal for hyaluronic
Yeah,
acid.
so most of the fillers on the market, you can dissolve them.
Gotcha.
So if I have somebody, especially if they're coming from somewhere else, and I always like to throw this out there, as injectors, like we've all had migration, like it's just a part of injecting. If you've had filler multiple times, especially the lips, like you're gonna need to start over at some point and dissolve it and start fresh.
Yeah.
But yeah, definitely. I don't like, if I see somebody has filler that's not placed correctly, or if they've had migration, we always start fresh.
Yeah.
So migration means it would go
It's
from the
moved.
lips to the
Right, above the lips. So we call it like the filler mustache.
Yeah.
The ducky lips. Like those are the
Yeah.
kind of terms that you may hear. But yeah, just dissolve it. Start over. People don't like to be without their lips for like 2 weeks, but it'll be okay. I tell them it's
So in
wait
the
2
art
weeks.
of it, you're going in and you're finding, like, say you would like, I don't know, you come in, I don't know what the hell I'm doing. You come in this way.
Mm-hmm.
Are you sliding out as you're pumping me in?
Depends. So there's a lot of
Or how do
different
you-
techniques. So you can use cannula, you can use needle.
Yeah.
When you're the lips, I use needle in the lips. But yeah, can you retrograde? I think that's what you were kind of
So
saying.
you're like sliding out as you're pushing filler in. So like kind of like toothpaste. I think of like putting toothpaste on
Yeah.
a toothbrush.
It's a good
To
analogy.
get it even. Okay. So that's the skill. How do you practice that? Like, is there like, are you working
Lots
on
of
like,
training, cadaver courses. I
Yeah.
probably do 2 to 3 cadaver courses a year.
oh, still?
Yeah,
Nice.
Even I don't think you're never going to be, these people are like, well, I'm a master injector. Who
Right.
came up with
Who
that
gave you the
term
title?
and who gave you that title? And it's a field that's not like a lot of other fields where you go to school and they put it on paper and here you go. It's all about training and teaching yourself, learning all the like continuing education. So I have a lot of people that are like, well, how do I get into injecting?
Yeah.
Like, what do I do? Yes, can you go and take a certification course? That's like a day or 2 days. That's not going to make you an
Sure.
expert in the field. Like, you have to put in the time and dedication and like constant drive and dedication to it for
Yeah.
sure. And doing it every day. I mean, I inject 5 days a week, all day, every day.
Yeah.
Stay right in
Oh,
Yeah.
sorry.
Randy's really good at baiting fish, and some people call him the master baiter. And I don't think you got a certification
There's
for
no
that.
certification for that.
No?
salmon.
Self-proclaimed.
I'm gonna have to
Salmon.
switch over to salmon.
Salmon.
How was it? So now you guys have a baby, right?
Yes.
How was that with business? Like, what changes? Just kind of speak to the business side with having a kid.
That was a hard, 2023 was rough. So we were opening the business. We decided to do that right after I found out I was pregnant. It was just time to make a move. We needed more space. I was thinking, like, how am I going to keep this business going if I have to take off work and I'm out? Like, I'm a solo injector. Mo had left his job to come on full time with me. So that's really when Sculpted came about. So we started building our brand, hiring the right people. I think a lot of business, especially when you're starting a new family, is putting the right people in place to support you and your staff.
Yeah.
And yeah, it was a whirlwind. We opened Sculpted May 1st. We had her June 19th. I took off 4 weeks and I went back to work full time.
Wow.
So that was it was a very,
It's a lot.
it was a hard year, but it was like the best year as well. So, and she's amazing. She's an easy baby. So that made it a lot easier on
That
us.
helps.
Yeah.
And Mo was great,
Mother-in-law
so-
was a huge help.
Yeah, and my
Yeah.
mother-in-law, I got to shout her out because we couldn't do it without her. She's her nanny.
That's great.
So
And I think when you talk about getting into the space, I think
Right.
it's nice when you've had a background in something else, like you're a PA in the hospital, you have to do everything.
Right.
And then you go specialize. You have so much experience in everything.
yeah,
Makes
Were
it
you a
easier,
PA
right?
or an NP?
NP.
an NP.
We have an MP, Jillian, who
PA.
is with us.
So
a
Jill,
PA.
Jillian,
PA, sorry,
our
excuse me.
other injector, she's a physician assistant. She's amazing.
Yeah. So I kind of know the difference between them now, but maybe tell people the difference between an NP and a PA.
So we are still both considered mid-level providers. It's just the track that you go. So like I went through nursing school, so I'm certified through the nursing board. A physician assistant is certified through the medical board. So schooling's a little bit different, just the foundations. But at the end of the day, we pretty much do the same
Same level.
the same
Yeah.
thing.
Got
Pretty
Yeah.
interchangeable at the end once you get experience.
Right.
Now, say somebody, does people show up with photos often? Like, I want to look like this face.
Oh, I'd bring Brad Pitt in.
I love it.
Can you make me Brad?
It's always that, like, do I ask if they have a,
Right.
what's the word I'm looking for?
Like an ideal.
Yes, especially when it comes to lips, you
Yeah.
know, because I get Kylie Jenner lips a lot. And,
Right.
you know, depending on what the client's lips look like starting out,
Right.
is that achievable? A lot of times, no. So, yeah, I always like, it's the time I ask, and I'm like, oh, I wish I would have asked them
Yeah.
to show me their like inspiration
they're quick
pic
to grab that
because
phone
I'm
and be
not
like,
going to
yeah,
be able to
actually,
give them that. So,
Right.
but I'm very good with being honest with my clients. Like, I'm like, no, that's not going to happen. You know, it might get you 50% of the way there, but I'm never going to get you like to that.
There you go.
So,
Now, have you had any like bad traumatic where like you were like, oh my God, I hit something I shouldn't have?
oh yeah.
Me?
Is it scary? It was
did. Yeah, so Mo was my model for a training one time.
You were in front of people when you did it?
The trainer.
The trainer.
Okay.
I've trained with her before though, and this
right.
was, you know, but the scary, should I talk about the scary thing with injectables or like filler occlusions? There's a lot of vessels and arteries in the face, which is why I do
Right.
so much continuing education and cadaver courses. But where something should be is not always where it is.
Sure.
You know, I don't have x-ray vision, so I can't see what's under the skin. I just know my landmarks. I use safety precautions. But yeah, so we had a little scare with Bo one time.
Did your like face
He was
blow out?
fine. He was fine. We dissolved, we flushed it, and
Yeah.
all was good. But, you know, I don't know if it made it easier or harder that it was my husband, you know.
Right.
That,
I'd rather be me.
But yeah, but that's, you know, it's gonna happen. I always tell people if you haven't had an issue as an injector, you either don't inject enough people or you haven't been injecting
Right.
long enough. So the main thing is just to know how to treat complications and be
Sure.
educated. So
So, I may have missed this. You were doing his lips?
no, yes, we were. I was doing his jawline.
Oh.
Yeah.
Trying to chisel my Brad.
Yes.
He had the Brad Pitt photo.
There's who's the guy that
Zac Efron.
Zac
Oh, yeah,
Efron.
he's a beast.
We
Oh,
gotta talk about this.
He's got so aggressive with his jaw.
Did he do anything? Do you think he
I
just
don't know.
did anything?
I
or
think. Well, he came out and said he had an injury, right, and like broke his
Yeah.
jaw. I don't know.
Yeah.
It looks to
He
me like
looks
he's had
a
work done.
I think he looks
But
worse than before.
I mean, he has just massive jaw muscles,
Right.
and it's so chiseled.
he reminds me of. He looks a lot like Rob Lowe. Is it Rob Lowe? Is that
Yes,
Rob
that
yeah.
sounds right.
He
Yeah.
looks. Yeah. But I don't know. I never like to say who's or make speculations on what people have had done. But yeah, definitely something different. His jawline's a lot more chiseled than it used to be.
yeah.
Yeah. And so that would be what? Fillers?
Potentially.
Yeah.
Yeah.
And there's some people that have the dimple right in the middle of their
little
chin.
cleft.
Yeah. Is that something that you can fill in?
It is. So you always have to be careful though, because some people are kind of married to that cleft. They like
Yeah.
it. That's their signature. So point for any injectors that may be on this podcast listening. Always ask your client if they like that, because if you
Right.
do chin filler and you take it away, they might not be very happy with you.
Right.
So
Could you create a dimple too with like the
no, I mean,
like a little?
I've never tried. Could I maybe?
A chin dimple?
I don't think that's more of like a muscle, like a bifurcation in the muscle. So yeah.
Is there anybody out there doing more wrinkles? Like they want wrinkles? In
I've
other
never
words,
found somebody that wants more wrinkles.
really.
No.
I didn't know if there's like the opposite side.
I will
where
tell
it's
you, my
like,
twin brother is
Yeah.
the opposite of me. I mean, like I don't have wrinkles.
Right.
He's
got 'em.
refuses to talks. So at least I can know what I would look like if I didn't have time.
That is, yeah.
Some people want to like soften their wrinkles. They don't want them gone. So
Right.
that's always the hard client too. It's like,
I
why?
still want movement.
I
you
still
know?
want movement,
yeah.
but I want it smooth. And I'm like,
Yeah.
cool. That's a hard one.
Yep.
Sometimes you can't have both. You got to pick.
Right.
Yeah.
But yeah.
And so what about the nose? If it's not perfectly even, can you do injectable? It's like a non-surgical nose lift or nose
I
job?
personally don't do them. I am trained to do the non-surgical rhinoplasty, but it's a high-risk area for blindness, so I personally don't do
God.
it. That's just my preference. I like to sleep at night,
Right.
so
Like-
I send them to plastic surgery if they want their nose done. You can slim a nose with Botox. You can help the tip, like I do Mo's. I like injecting right here.
Oh,
to kind
just
of,
the tip.
yeah, just the tip.
and what happens when you do
So
the tip?
when some people smile, tip of their nose goes down.
Yeah.
Yeah.
If you relax that muscle right here, when you smile, it just
Yeah. You can also do threads. So like I was talking about the threads, you can do threads and noses too.
Yeah.
But yeah, I don't put filler in noses. Not saying there's anything wrong with injectors that do.
Right.
I'm trained on it. Yeah. High risk areas, forehead, nose, I just stay away from.
How about eyebrow regimen? Should there be? Do you guys do anything eyebrow wise?
Oh, yeah.
Eyebrows.
Yeah.
So we do permanent makeup. So if somebody wants like combo, microblading.
Should dudes be doing that?
I mean,
Like,
they
what's
want to.
What's Mo doing?
They
He
wax
gets
them.
some wax.
He's got a fade. You kind of have a fade in here.
They wax
They
them
trim
for
them
me
down,
and
yeah.
trim them down. Right.
Yeah,
Right.
brow
Get
liner.
that fade.
Nice.
Get that fade.
We got to get in the eyebrow game.
But
All right.
and then there's the lifting threads.
Yeah,
for
I do
brows.
thread lifts too for brows, which is
So someone
Does that get
want a higher
risky?
peak.
with
Like
No.
where they just look surprised all the
no,
time.
no. It relaxes. I always tell them like you're gonna feel like super awake and crazy when you walk out of here,
Right.
but it's gonna relax and settle over the next
Gotcha.
week or so. But yeah, you can lift brows with Botox too.
What are the threads? What are they made of?
They're made of PDO, so it's polydioxetone.
Okay.
It's the same material they use in the OR for surgery. So like dissolvable sutures.
Oh,
Yeah.
They're just different. They got like barbs on them, so it
Some
They're
of
like
them.
grips.
Exactly.
connections to the tissue, right? Versus what the surgeon's closing you up with is
Yeah.
smooth.
So it dissolves.
It dissolves over time
Oh, I
and
didn't
builds
realize
collagen. So there's two types. There's smooth threads. There's lifting threads. Lifting threads are like my non-surgical facelift, so literally repositions the tissue. Smooth threads are more for collagen boosting and tightening.
Yeah.
So I do a lot of smooth threads for like under the chin. People don't like that little loose skin there. Great for that. Yeah, I can put smooth threads anywhere.
really?
I put them in knees,
Careful,
bellies.
Tom. I know where you're.
Yeah.
Yeah, I was wondering.
Put them anywhere.
I see the wheels turning over there, Tom.
Well, we saw. We went out to where was that? Either Illinois or Texas, where they're doing, and maybe you guys do this. They're injecting wieners to get them
Oh,
bigger
yeah,
or
no.
harder.
No.
That is
You're
a
not
thing,
into that?
but no.
You guys
I'm
are
not
into
doing
that?
that.
There's
I draw the line. I'm like, there's something.
a
I'm just
certain
not
thing.
doing it.
But
no.
yeah, that's become a thing.
Yeah, because they were saying for some of these guys, it was like life changing. Obviously, for
yeah.
I think it was if it was curved.
well,
They
it's
were
could
doing
straighten it.
Botox, so it would straighten.
Right.
Yeah, I told him if he can do that, he can. He's
I'm
licensed to
good.
inject, but I told him about nope.
Send your wieners to
do.
Mo.
Right. Right.
Send your wiener pictures.
There's another slogan. Send your wieners to Mo.
Free
Yeah,
assessments.
I like to think we stay busy enough. So
Yeah.
we're
Yeah,
gonna
no,
stay
no.
clear of that one.
Yeah.
There's some. I think there's a local one.
There's a local guy that does it, or
I don't
gal.
know. That's what I hear.
I can see that.
I'm not bringing that one up. as he's getting slapped in the arm.
Now, do you typically go sleeveless when you're working?
Depends. I'm cold natured, so
Yeah.
I don't know. I like my jumpsuit. I just got this
See,
romper.
I
the
was
other day.
thinking
I like
Randy
it.
might need one of those.
Yeah.
That
I'm
might be
always
your
jealous that especially when it's so hot and you're doing stuff all day long, it'd be nice to be sleeveless.
Yeah.
Little
Get
air
the
out.
guns out there.
Yeah.
Shorts. Throw some
Haven't-
shorts
haven't
on.
got
That'd be
one
nice
to-
too.
To get a romper yet or jumpsuit.
No.
Oh,
Can't talk
romper
you
would
into
be
that.
sweet.
A
dude.
male
Little-
romper?
You come in with a male onesie for adjusting.
Yeah.
It's
I don't.
like
I
with
mean, I don't know
those
if I can pull that off. I don't
Yeah.
know.
I think we got to design it. We could probably sell it to chiropractors.
All right.
Yeah.
Maybe
Like
we'll put like a little
Maybe
bow
I'll do
tie
like a
too.
shapewear thing under myself.
All right, so tell us both of your personal regimens just for skin, sculpting, maybe even working out, diet, sleep. You don't have to go that deep.
Well, no, I said working out. I'm like, yeah. I chase a 1-year-old around, so
Right.
that's my workout. Yeah, skincare. So I do like to have my skincare regimen. I don't do a lot, honestly. I haven't done a lot of fillers on myself. I love some PRF or under eye treatments. I do my Botox every 3 to 4 months. Actually, it just kicked in. I got it done last week. Skincare, like I was saying earlier, I have a good cleanser. I love Skin Better products and Zoe products. I like them all. But yeah, vitamin C,
And
retinol.
that's daily. That's like
That's
your
daily. That should be your go-to. I tell my clients, like, you don't need 50 million products. You need the ones that really work and are going to
Right.
help your skin. And it does. I don't have time for a complicated regimen. I'm busy. So I have the basics. Yeah, so my retinol, vitamin C. What else was I saying? A good moisturizer. I love my Epionce moisturizer.
Sunblock.
Sunblock every day.
every day.
Yeah, even during the
Really?
winter. So we think like if you're not out in the sun, you're not getting exposed to UV. You are always driving in the winter. So I tell my clients daily, even if you think you don't need it, just make it a part
Yeah.
of like routine.
What about all the benefits of the sun? You're missing all the bennies.
Well, 5 minutes a day. So there's like a study out.
5 minutes?
5
That's
minutes
it?
a day is really all you need in the morning to
vitamin
even
D.
get your like circadian rhythm going.
Oh.
Yeah. So you really don't need that much sun exposure. And even so with sunscreen, you're still getting some of that UV radiation. You're just not getting near as
Yeah.
much. So it's blocking out the bad UV. So,
I love getting zapped by the sun.
I get.
I mean, yeah, but
I'm worried about
There's
the
something-
chemicals. Like whenever I'm putting a chemical on myself,
Right.
I feel like it's getting absorbed into my body, and I don't. I'm
well,
nervous
get a good
about that.
medical grade
Right.
sunscreen that's like mineral based.
So our retail products that we're discussing, you can't just buy at Walgreens.
Oh,
You have to come to a medical spa,
Yeah.
and so
Yeah. And most of those are made like for the face specifically.
and
So
studied.
yeah, do a medical grade.
And the mineral,
sunscreen.
so the mineral ones are way better for you than.
There's
the other
physical,
ones, it
there's
seems like.
mineral. I like minerals a little bit better, protects better. I think it's a little bit safer for the skin. So I usually do a mineral based sunscreen.
Nice.
And I'm pretty simple on my regimen.
Yeah, what are you doing? Bar,
I've got
bar soap.
I've got just for the body. I do have a good facial cleanser, and then in the shower that I use every day, and then every couple of days I'll use an exfoliator for while you're cleansing. And
That's
then,
just the stuff that has like the
little
crumbles.
beads.
I'm into exfoliating too, but
nice.
no one talks about it.
oh,
Exfoliating is perfect.
I'm
It's
on,
all that
I'm
dead
on it,
skin
man.
off.
I love it. And then, but like I said, every 2 to 3 days on that one, and then we've got a good facial lotion, and sometimes I put sunblock on. And then
He's
tox.
much better. Much
I'm
better.
all about the tox, man.
You like getting
I do.
some buff.
I like a little bit of movement, but I don't like wrinkles. So
How often are you doing?
I'm probably every 3 months. 3 months is goal. If you hit 3 months, good for you. That's awesome.
You're
if you're
dialed.
over that, really good for you. If you're under that, we probably need to switch toxins.
Or just up your dose. It's
Or
usually
up the dose,
more
right.
the dose is too low, not that your
Right.
tox isn't working anymore.
So that's kind of like the shelf life is around
3 months.
that.
3 months is
Yeah.
goal, right? For sure.
Sculpture is a big thing too. I forgot to mention that with my routine. I do Sculptra like
What's
once
that?
a year. It's a biostimulator, PLLA. So it builds
What's
up
that
like your
mean?
natural collagen,
Keep going.
polyl
not
lactic
helping.
acid. But it builds up your natural collagen. So it gets some volume without having to do fillers. And again, I like to tell people like filler, my little saying to my clients, I'm giving away my stuff.
Yeah.
Filler is like you rent it, right? It's not yours to keep. Your body's gonna break it down. Like Sculptra is yours to keep. You buy it. Like that collagen is yours.
Yeah.
You know, yes, are you gonna naturally break your collagen down over time? Sure, but it lasts a long time. The results are supernatural. So I'm a Sculptra girl or hyperlute radius.
And that's
They're the
actually
same.
injected under the skin with a needle.
What do you guys think of just people taking collagen powder?
I get that a lot. I think it has its benefits. Do I think it's going to make new collagen, like, or, you know, make your wrinkles go away? No. But I don't know. There's a lot of good studies with, like, collagen supplements. So I do think it has its place for sure. I do think it helps your skin look better and just healthier.
Yeah.
But yeah, I don't think it's the same. Depending on what you're trying to use it for. I mean, if you're using it for facial like volume and treating fine lines and wrinkles on your face, like you need an injectable collagen,
Yeah.
in my opinion. But you know,
So when you're looking at how a person wants to look, is there a certain age that they want to stay looking? Like I think if you're 20, you probably don't need to do
Much
a bunch of stuff, right?
Right.
But if you're 30, you might need to do some or you might not, depending how you look. If you're 40, but I feel like as you get older, it seems like, and I don't know this for sure, the ideal would be a person looks at you and they can't tell you if you're 70 or 60 or 50 or 40 because you just look 40. Right.
well, I think your
Or
body,
30.
you're gonna age. Like we're all gonna age, right? The face changes. Like there's a whole thing. Like if you really want to get into facial aging, but that's boring and really scientific. But I think it's just aging gracefully is what I think is important. Taking care of yourself. It's a lot easier if you do start earlier. You know, if I have a client that's coming in that's never done anything and they're in their 60s or 70s, that train's kind of like left at that point.
Gonzo.
Are there things that we can do? Yes, but it's going to take me a lot longer, and we're going to have to set like realistic expectations on what I can do, right? Because I'm not a surgeon. I can't do a facelift. So a lot of what we're doing in aesthetic medicine now is more preventative. starting our clients earlier, you know, in their late 20s, in their 30s, or even in their 40s, to really kind of keep them looking their best and younger and not like getting to that point. So, I mean, like Mo's 42. He looks great. Like most clients think he's in his 30s.
Really
Is that, do you ask people that? Because
that?
it's Tom's favorite thing to do is ask people how
Yeah,
old.
Randy's much older than you, looking, but he's actually younger than you.
I always say, hey, I'm obviously it's better than the alternative. You know what I mean?
Right.
But I don't want to look 42. I can be honest with you there.
What do you want to look?
For me,
Like, what would be your ideal guess? Because I always think that whenever Tom asks everybody that we meet, how old do you think Randy is?
right?
Like, I know that I don't want them to guess 48.
But they
but
have.
they have. But I also don't necessarily, I'm not like, oh, I hope they say 23.
Right.
Because I'm like, I'm not,
Now
there's
you're
no
just
way
filling
I'm
me full of shit.
23.
Right,
Yeah.
right.
But I don't know what the right age. It's just it feels weird to me, which is why I can never quite figure out what my goal would be because I don't know what my goal age to look like would be.
That's a good question. I would be like, as long as you thought I was mid to late 30s.
I think, yeah,
I'd
mid-30s
be
is
happy
your...
with that.
5 years. So
Yeah.
Well, yeah, if you could stay 35 when you're 50, but you should probably still target like 35.
well, yeah, but when you're 50, do you want people to be guessing that you're 43? Like when you're 50, you're not like, oh, 8 years from now, I hope people guess I'm 35.
Right.
Or do you? That's what I don't know.
Yeah, probably early 40s at that point.
At that point, right.
Well, I
so it'll
think-
go up
Right,
with
like
age.
5 to 7 years.
Right. I like where your head's at there.
Yeah. But most people don't come in and like put a number on it. You know, like they're like, I want to look refreshed. I feel tired. I want to
Yeah.
look less tired. I'm like, you're my ideal candidate, like client, because they have realistic expectations. They just want to feel better about themselves, you know? So I don't really think a lot of people try to put a number on it. Like, oh, I want to look 25 again.
Right.
Most clients are saying, I don't want to look 25. I know that's not going to happen, you know? And I'm like, perfect.
Yeah.
Because I can help them. I can make them feel like $1 million.
I know. I just like that I can't get away from the number thing in my head. Like if I was 40 and I felt like I looked 45, I'd be really motivated
Right.
to be doing whatever I need to do to look 40 or 38. But if I was 45 and I looked 40, I would be like, what number am I trying to get to?
I got you.
Or maybe age, like you said, age isn't even a thing, and maybe I just think it is. Like it doesn't
Yeah.
matter, whatever age you look like.
Right.
Just want to have salt and pepper beard. Salt and pepper beard is
Salt and
where
pepper
that's the thing. You can't look under
It's
35 with
No.
a salt and pepper
Right.
beard.
Right. No.
Nope.
I can't see myself ever coloring my beard though.
Is that
That's
in?
tough. No, it's weird.
My hairdresser told me not a chance.
Right.
No, it gets weird.
He said that lawyers are actually trying to go more gray because it makes them seem more distinguished.
Right. Yeah. I like the salt and pepper.
Are you guys big birthday celebrators as adults?
Mo, yes.
Mo loves a
Well,
good,
we go
Mo
somewhere
loves a
every
good
year.
birthday.
His birthday
there's
is
a
like
catch to it. I'm 2 days after Christmas, right?
Oh,
so what
yeah.
we always do, and we like to travel. So what we always do is we do the family thing on the 25th, 26th. We're out. We're somewhere in the Caribbean for my birthday and for New Year's. But so it's not for my birthday. It's
Right,
because
right.
it's for his birthday.
He wants a big deal, everything.
No, he's
cakes.
really not at all. That's like always been our thing
always
is
go
we go
That makes
somewhere for his
sense.
birthday.
I like that.
No, I do the same thing too. It's always like, oh, my birthday's coming up. Our anniversary's on the 10th of April. My birthday's on the 12th. We're
yeah.
going away for
Right.
our anniversary.
knocking out.
It's really my birthday.
That way we got birthday and New Year's in there.
Yeah.
I mean, I've shared a birthday for 42 years, so it's not
Right.
like it's, you know.
He's
get
an
together
identical
with him?
twin, so yeah, he's
Do you get together with him a lot or no? Yeah. Is he
we're
local?
close. No. So all my family's in Missouri, where I grew up.
Oh, nice.
And then my twin's actually in Indiana. But we pretty much, the oldest one and he and I, my twin brother, we have a group chat that we probably talk every day.
Yeah. Yeah.
Is there anything that he's like way better at than you?
Like who would win in a fight?
oh, good one.
Good one. I don't really remember fighting much with.
Like a fight to the death.
Somebody's dying.
I like to think I'm living there.
You're going all out.
But yeah, we have the exact same build, same everything.
Like golf. What about golf? Head to head
Ooh.
golf.
He's playing a lot nowadays.
Is he?
He joined a club and the bug bit him, so he's playing all the damn time. And he's got a job to where he can play a lot.
Yeah.
I've got a business
You're-
and
yeah.
a 1-year-old, so even though I'm still a member at a Columbia
Yeah.
Country Club, I haven't played in probably 2 months. But I honestly, and if he was sitting here, I'd tell him I still think I could beat him.
Yeah. Always.
Yeah.
they're very competitive, but in a good way.
Right.
Now, do you guys work with any local plastic surgeons or anybody in the surgery? Like, if you needed somebody wanted breasts
that
like,
we
but
could send.
But you like they start at your place, and then they're kind of like, oh, let's.
There's
get the-
several around here
No,
that I could definitely.
Let's increase
That's a good
the-
question.
There's definitely several around here that I would refer clients to.
Yeah.
Also have, one in Charlotte, one in Charleston. It really depends on what they're wanting.
Right.
So I want to send my clients to the best, but I think there's some amazing plastic surgeons in town that we have good relationships
Yeah.
with, and I
And
don't
like
ever
you
like to
said,
say
it's
partnership,
either
but yeah.
breasts or eyes.
Oh,
is
what are
the
they
two
doing?
big ones.
Eyes, like eyelids.
Yeah.
Blepho.
Oh,
Or facelifts too. I mean, a lot of my
Yeah,
clients,
facelifts. I didn't think about that.
yeah.
there's something that's beyond what I can do. Like if they are even considering surgery, I'll have them go see a plastic surgeon because I'm like, you're going to spend all this money and time with me coming to get, a thread lift every year when you could just splurge on the facelift and be set for 10
and
or
that's
15
permanent
years.
or
Well,
longer.
Nothing's ever permanent. 10 to 15 years. A lot of facelifts, usually they'll go in and do another one, like usually 10 to 15
Revise,
years
yeah.
later,
Yeah.
the revision.
Is liposuction a thing still? Like, are people doing that?
Oh yeah,
don't
I
hear
love
about
to
it.
refer for lipo,
Oh, really?
especially for under the chin. We have a fat dissolving Cabela, but sometimes it's easier just to refer for lipo. It's very like straightforward these days for that area
Yeah.
specifically, and I think it works great. So
So a lot of people are going out of country for stuff like that. Do you
Yeah.
deal with any like?
That worries me.
I know.
I mean, as strict as the FDA is, I still got to hand it to them. You know what I mean? As far as regulatory bodies are
Right.
concerned, I can't imagine going down south and having something
Like
random
Costa
done.
Rica to get your
Right.
teeth done or
Right.
something. Yeah.
The nice thing about doing it here, I've
you
tried
do it?
all that stuff. Oh yeah.
Teeth are a different story, though.
Well,
I'm talking like
yeah.
major
Oh
abdominal
yeah, like
plasties.
Argentina,
and, right.
Colombia. They're doing all kinds of stuff. That's
well, turkey's hot for hair,
yeah,
Really?
turkey's doing
Yeah.
a lot of.
but the problem is the thing that I like about being here is you could ask 10 people that have gone to the person,
Right.
how was it? Oh, it
Mm-hmm.
was amazing. Great. You can
Right.
go do
Check
it with the
those
person.
reviews and-
But if you're out of country, you don't really, you're hoping that somebody online is telling you the truth.
Right.
That's
My
not
only thing
great.
with that would be follow up. Like if you
there's
have
complications
surgery, because
also,
there
true.
are amazing surgeons in other places that do things that we don't do here. And even with the aesthetic industry, what they have available in like Europe is
Ooh, tell us
way.
like what?
well, Europe's always ahead of the game. in
Right.
Right.
I feel like in
Are
the
they? I
makeup
feel
and-
like they just
Well, even like
yeah.
fillers and
Well,
stuff, what's
sleep more.
available.
Yeah.
Ours, we kind of get things like 5-10 years
Yeah.
later.
yeah.
Because it's so
But,
hard to
yeah.
get through FDA approval.
oh, is that why?
Right.
Yep. Do you guys ever look at each other and think, man, I wish Whitney or Mo did this? Like,
Like,
Treatment.
Aesthetic wise?
yeah.
Yeah.
don't
No.
answer
I
that.
can tell you what I don't want her to do.
Let's
My
hear
lips.
Oh,
it.
what?
Really?
These are natural lips.
Oh, nice.
Don't mess with those. Come on.
I think I'm
yeah.
going to do them next month.
I know.
Uh-oh.
Uh-oh.
It'll be okay. Just a little bit. Just a little bit. Hydration.
Right. Right.
Yep.
But no,
no,
I
that's
think
the only
he's
thing I can
perfect.
think of.
I like great answer.
But you should have seen him like, oh, I wish I had that
Before
picture.
you started working on them?
Yeah, it's on my Instagram. I have his before and after on my Instagram.
Really?
From when I met him until now.
Yeah.
Which was how long ago?
4 or 5?
5 years ago?
See, that'd be a good T-shirt too. Just a before
Yeah.
picture and after
But-
picture.
It gets,
That would be
Or one on the front and one on the
crazy.
back.
a lot of my clients, like after I posted his, I mean, I had like several of their husbands in my chair the
Right.
next week because they were like, I don't know what you did to your husband, but can you
Right.
do this to mine, please? I was
And
like, "I'll do
anytime
my
I get a
best."
compliment, oh, you don't look 42. I'm like, well, I'm married to an injector.
Right. Right. And then my last question was just, what's the like ultimate vision? What do you guys have? You guys been thinking about what's next? Expansion? Kind of talk about that.
I think for now, we really want to continue to focus on Sculpted in Columbia and just building our brand, expanding out from that I think we're pretty set on our services right now.
Yes.
I think I'm happy
No
with
more
everything
devices.
we have,
Yeah.
just building and growing. We're very involved in the community. We like to give back too, so that's always important to us. And maybe
It's fun to get involved with,
Yeah.
like 803 Day last week.
Right.
Just things like that.
Yeah, yeah.
The Free Times is a great partnership as far as advertising and things like that.
Yeah.
They've always got something going on
Sure.
as far as parties and things like that. So,
Yeah.
it's fun to be a part of all that.
Nice.
yeah. So maybe expanding, that would be my 5-year plan. But
Yeah.
there's a lot that goes into that too.
You
I always
got to have
tell-
3 or 4 more kids first before.
Oh, I think we're one and done.
Yeah.
I think we're one and done. But yeah, I think we're happy and like where we're at. Like,
Right.
I never expected any of this 4 or 5 years ago. So I think I'm just kind of enjoying where we're at. And like I said, just continue to build Sculpted and make a name for ourselves with that. Take care of our clients, be able to be the best at what we do.
Great.
Yeah.
Yeah,
I love it.
that's great. So my last question is about price point, which I know people are probably wondering about. What are kind of the different levels and where should they start? So should you expect to be going every month and you spend a few $100s a month? Should you expect to save up over 6 months and then do a lot every 6 months? Or what does the protocol look like for people who are thinking about that?
So it depends on what services you are interested in. We have an amazing VIP membership. So our clients pay a certain amount every month, and then they get discounts on everything in-house.
Nice.
So that's a great starter place for them. But yeah, it depends on the person. It's just like with Botox. There's not a set number of units for everybody.
Okay.
But when clients come in, we do a complimentary consultation. So we always like to first kind of see what my client's interested in, figure out their budget, and then I'll work with that. So what would you add to that?
We have payment
Liv?
plans too.
Oh, yeah, I forgot about that. We have payment plans. That's awesome.
And
It's
it's
like
a
Cherry, so
great-
it's Afterpay.
Right.
Afterpay for injectables and med spas.
So they can,
So, yeah.
if Americans, we want it right now. You know what I mean?
Right.
So then, and it's a great soft credit check. A lot of people get 0% interest for
Nice.
it's 3, 6, or 12 months. So
Is that care credit? Or no?
we do.
We-
We accept care
Oh, you
credit
do?
too.
Nice.
We do,
But
but Cherry
Cherry,
a lot. We use Cherry a lot more. It's a lot
gotcha.
it's easier. You don't have to have like a credit card for that. It's literally like if you're familiar with Afterpay, it's pretty comparable. So yeah.
Nice.
Great.
Easy.
And then how do people find you again? Websites, Instagrams, secret Instagrams for Mo's
Personal cell phone
OnlyFans.
numbers.
So our website is www.stay-sculpted.com. Instagram is stay_sculpted. Mine is wit_sc_injector. Mo's on there too, but he doesn't really do much with social
You don't
media,
wanna
so
follow
don't
him.
message him directly. Just message me, or check out our website. So we're at 701 Lady Street, Suite B. If you know where M Vista is, we're right next door to M Vista. We are open Monday through Friday, one Saturday a month.
Phone number is 803-708-0178. And like Whit said, that website's got a ton of before and afters. The Instagrams all have a ton of before and afters. Because at the end of the day, that's what people want to see.
Yeah, and our pricing menu is on there as well. I'm very transparent with that. So anybody wondering where pricing starts, literally on our website, pricing menu has all of that available. There's, it's not 100% when it comes to the pricing menu, but that gives you a very good basic starting point, and then we'll tailor that once you come in for your consultation.
Sweet.
Love it. Thanks for being on the show.
Thanks,
All right,
guys. It
thanks
was
for
fun.
having us.
Here
We're here for the health of it.
for the health of it.